Prenatal care. No drinking, no drugs, no smoking. Eat better. Take vitamins. The most important things a woman should do when she finds out that she is pregnant.
Yeah, our conversation on healthy pregnancy continues now with Dr. Kim Newton of the Center for Women's Health Care at Stony Creek. Thank you so much for joining us today. And you say that prenatal care, is at the top of your list. Why is that?
So for me, prenatal care is where it all starts. Just like with any health condition, you want to make sure that you have someone who's looking at you, looking at your baby, and making sure that everything's as safe and healthy as possible. And that starts with prenatal care. Early and consistent prenatal care has been shown to have really good outcomes for mom and baby. It has that one person who looks at all of your history and says, do this, don't do this, based on you, not just based on guidelines.
Taking care of mom and baby. Okay, before we get to our next question, we want you to weigh in at home. For your medical needs, where do you turn to for peace of mind? Some options are doctors only, apps, Google, your parents, or do you consult with your friends?
Yeah, so let's talk about some do's and some don'ts. You mentioned a little bit about food and you should be eating healthier. So what kind of foods have the best, nutritional value for moms to be?
Absolutely. That is a question that I get all the time in prenatal care because we say eat right, but we don't necessarily say, what do you eat, right? However, some of the things that hold true just in general life hold true in pregnancy. Fresh fruits and vegetables have a lot of nutritional benefit for moms and babies, and healthy lean proteins. We all remember that food pyramid when we were growing up. That's exactly what you want to eat during pregnancy as well. It helps you have a good, healthy pregnancy. Just really focusing on those lean proteins and healthy fruits and vegetables are really a good way to start.
So having maybe a French fry once in a while is okay?
Correct. Yeah, in pediatric care and maternity care, we could talk about sometimes foods versus every time foods, and fresh fruits and vegetables are definitely an every time food. French fries, maybe sometimes.
Not too often.
Not too often, but sometimes.
What about for all moms? What's your #1 piece of advice for them?
Absolutely. So that's kind of a trick question because prenatal care is what we already talked about. So early and consistent prenatal care is really important. And I really think that women need to have a good support network so that they can get through their pregnancy in the most healthy way and have someone there for the delivery of their baby as well. So friends, family members, that sister, brother, person who loves you, who you can call at 3 a.m. when that baby's crying, that's the person you want to support you during your pregnancy. And whenever we're doing prenatal care, we're hoping to be part of that wheel of support for that mom.
Yeah, support in anywhere you can get at this point, right?
Exactly.
You want that baby.
Army.
Yes.
Yes.
That
takes a village.
It does.
So let's talk a little bit more about the app that Tracy profiled before the break. It's called Baby Script. So do you think that moms will have a better handle on pregnancy because of apps like that?
Absolutely. I think the thing that I love best about the Baby Scripts app is that we're meeting moms where they are. They're using their phones. We have this power in our hands, and we want to make sure that we're directing women to good, validated resources that help them know what's healthy and what's not healthy in their pregnancy. So I think these apps are really helpful for women to have that question at, again, 3 a.m. What should I do with my baby right now? That's a great place to start.
All the resources available, everything is beneficial for moms to be.
Exactly.
Dr. Newton, thank you so much for your time.
It's my pleasure.